Hi, my name is Flor Parrales. I talk about apixaban to prevent venous tromboembolic in patients with cancer. Definition: venous thromboembolic disease (VTI) diagnosed incidentally in the oncological patient is an entity whose frequency has increased significantly in recent years. This is due to the wide use improvement of the imaging test used in the staging of the tumor disease, in the evaluation of the response to treatment of during the follow-up of the oncological patient.
Venous thromboembolism is a common complication of cancer. While subcutaneous low molecular weight heparin is the standard treatment for cancer-associated venous thromboembolism, the role of direct oral anticoagulants is unclear. A randomized open-label non-inferiority study of 1,046 patients with cancer and confirmed venous thromboembolism tested the efficacy of anticoagulant therapy for up to 12 months. One group was treated with subcutaneous low molecular weight heparin for at least 5 days, followed by 60 milligrams of oral edoxaban once daily. The other group received 200 IU of subcutaneous dalteparin per kilogram once daily for 1 month, followed by 150 IU per kilogram thereafter.
Application in nursing. It is advisable to use the well scale to establish the rate of the patient experiencing and DVT. In patients with a low clinical probability, the negativity of the dinner allowed to exclude reasonable safe thromboembolic, and it would not be necessary to resort to new exploration. Venous ultrasound would be indicated in patients at risk moderate or high and or possibility the dinner. In patients with moderate or high clinical probability and the dinner, possibly with a fair normal venous ultrasound, would the advisable the repetition of this on with letter of exclude or definitively establish the diagnosis.
Venous thromboembolism is a common life-threatening condition in outpatients with cancer. Now, the question becomes, how do you lower the morbidity and the mortality, not to mention the costs? Cassini trial. First off, thank you very much. I'm with Dr. Allah Khurana, who is an MD and a professor of medicine at the Cleveland Clinic Lerner College of Medicine and also chair of oncology there at the Taussig Cancer Institute. So the question I had is, really, you're trying to figure out the role for extended thromboprophylaxis in this patient population. Why is it so difficult?
It's difficult because we're talking about a really long period of time, because cancer patients, we're used to doing thromboprophylaxis when patients go into the hospital, but that's for like 3 days, 5 days, 7 days. We're used to doing thromboprophylaxis.
Patients you were looking at in Cassini.
Yeah. So there have been other trials of outpatient thromboprophylaxis that have been done before. The two large ones were Protect and Save Onco. They came out about several years ago. And they were statistically significant, so they showed a reduction in events, but a lot of people question whether they were clinically significant.
Pro and cons. In the analogy of difference of mean between case and control on the Wheel scale, it was found that the patient who developed the disease at a higher score on that scale compared to the control, with a student the 12 and see which gave that is statistically significant. On the other hand, a body mass index and the Caprini scale did not have a statistically significant score, and is no difference between case and control regarding this variant, and the result of difference between these variant is no accurate.
Prophylaxis after venous thromboembolism after total hip or total knee arthroplasty has been found to reduce morbidity and mortality. Extended duration of postoperative prophylaxis has shown additional benefit, particularly in patients undergoing total hip arthroplasty. In this multi-center double-blind randomized controlled trial involving 3,424 patients undergoing total hip or total knee arthroplasty, patients received 10 milligrams of rivaroxaban once daily for 5 days postoperatively, and then were randomly assigned to continue rivaroxaban or to switch to 81 milligrams of aspirin daily. Prophylaxis was continued for an additional 9 days after knee arthroplasty and 30 days after hip arthroplasty. During 90-day follow-up, the rate of symptomatic venous thromboembolism was 0.64% among patients in the aspirin group, as compared with 0.70% in
Apply in Ecuador, and the 75 and 3% in patients with high, moderate, and low probability, respectively, of the presenting it. Other clinical model of prediction, but its use has not been generalized, and currently there are recommended for their systematic application. In short, it is advisable the use of clinical probability model before a patient with suspected tromboembolic venous. This is the first step in the algorithm to be able and diagnose or exclude the disease quickly and easily, without the need to resort to exploration more expensive or invasive. Conclusion: apixaban therapy resulted in a significantly lower rate of venous thromboembolism than did placebo among intermediate to high-risk ambulatory patients with cancer who were starting chemotherapy. The rate of major bleeding episodes was higher with apixaban than with placebo. Thank you.
Preventing and treating venous thromboembolism, or VTE. When a blood clot forms in the veins of the body, it is called VTE, or venous thromboembolism. Let's break down the meaning of these long words. Venous means vein. Thrombus means clot. And an embolism is where the clot moves through the bloodstream to another part of the body. There are 3 types of VTE: 1. A clot in veins just under the skin is called superficial vein thrombosis. 2.